Okay, welcome to this Appointments Committee on Monday the 14th of September. Before I start the meeting, I'm going to ask for apologies for absence. Are there any apologies for absence?
Yes, we have apologies from Councillors Nigel Moore, Richard Boyles and Paul Hodgkinson. And we have substitutions present in Councillor Tim Harman, Councillor Carol Alloway Martin and Ian Dovey.
Thank you. Moving on to the minutes of our previous meeting held on the 6th of March, probably the last actual physical meeting I attended of this council. Anyone got any questions on the minutes, or are you happy to approve the minutes?
Yeah.
Happy, content? Anyone else got any issues with the minutes? No, so those minutes are approved. Moving on to agenda item number 3, public questions. Have we received any public questions?
None received.
Thank you. Item 4, members' questions. Have we received any members' questions?
None received.
Thank you. Item 5, Executive Director of Adult Social Care and Public Health. Report has been circulated pages 5 to 8, and I invite Mandy Quayle to present that to the committee. Mandy.
Thank you. I think the report is fairly straightforward, it speaks for itself. Pete might want to add, I suppose, a little bit of context I would put in is obviously aware Margaret is due to finish in spring of 2021. We know from a range of research that it is a very challenging market in terms of recruiting to adults social care posts as it is with children's. Having reviewed the market, anybody we brought in who's likely to apply would need to grow into that role. And equally, it's a challenging market in the public health environment. We've also had a significant amount of change already within our top team, and we have a senior officer with significant potential that we're at risk of losing. The current balance of skills is positive, and we have some very strong operational deputies in both the adult social care and the public health space. So having reviewed those numbers of factors, we came to the conclusion that this was a reasonable and positive way forwards, balancing, as I say, the likelihood of recruiting externally and the benefit of retaining some internal stability. Pete, did you want to?
Just add a couple of bits of context. We had the LGA Peer Challenge just over 2 years ago. That said we should be tidying up our operating model, essentially our top structure. This would do that, and I'd highlight the overlap in partnership meetings between the DAS's role and the Director of Public Health role is just massive. There's almost not a meeting where we aren't sending 2 of our directors along. They are looking after very much an overlapping client group of vulnerable people. So there's a lot of rationale why this works, in addition to the points that Mandy's made.
Thank you, Mandy. Thank you, Pete. I'm going to open up to members' questions. If you could wave frantically at the screen, it's probably the easiest way. Ian. Ian, you're on mute.
A couple of clarifications. Mandy, you said that there were strong deputies in both adult social care and public health in Gloucestershire here. So is there no chance that one of those deputies might actually come through? And also moving along to this idea of the combination, which is an interesting one, but I'd like to know whether it is a pattern that has been replicated in other local authorities, or will we be a pioneer of this combination? because we've done a little bit of research, and Stephen Radford Hancock has not yet found a local authority which does combine it in this way. And my third question, if I'm allowed three at this stage, is you say, Mandy, that there's a national shortage of officers, adult social care, and also at public health, and I don't doubt that. But how do we actually know that we would not have been successful? We have a wonderful county here. How do we know without testing the water that there might not be a highly suitable applicant, even if it is a testing environment? So those are my three questions, really, at this stage. Thank you.
Mandy?
So in terms of the strong deputies, they're strong deputies, but actually they're relatively recent appointments. So they are, they've certainly demonstrated their value. Siobhan coming through in terms of the recent appointments with the current public health pandemic, and Dawn Porter clearly has demonstrated her value through the adult demand management programme, but they're still relatively recent and growing into their own roles. In terms of the third point, we have done quite a review of most of these, the people on these markets are known on the DAS circuits. And we couldn't guarantee it. And these things are a sort of balance of the choice for the organisation in terms of whether we're growing internally. It's just known, known on the circuit that there is, these are tough posts to fill. And we've certainly had conversations with recruitment consultants who are involved with filling these posts regularly, the type of people who are looking at the moment. So we have explored that and balanced that off with the benefits that we've talked about in terms of creating some stability internally, and going with what we know. In terms of the has this happened elsewhere? I can't remember off the top of my head the specific examples. There have been one or two examples, but it is relatively unusual.
Yeah, I'd add, though, that the Director of Public Health sitting under the Director of Adult Social Services is relatively common. I would suggest our COVID experience is a really good reason why that is not where we want to be. At the moment we are incredibly well served by Sarah, and I'm not sure if we'd ever had that post at a essentially deputy level, you'd have had the same attraction and the same personal development happening. But no, it's quite common for that post to sit under one of the main directors.
Thank you both for that. Does anyone else have any additional questions? I've got Leslie, then Tim.
Thank you very much. Are there any particular criteria that the Association of DAS members expects? Is there some link with any legislation that they have to comply with? That's a question. I have to express, I want to express I'm not happy about this. I think the role of public health is so important, and I think that it deserves a status. And I think by joining the two together, whatever the arguments, and it is unusual, I've been sort of trying to find out if it's been rolled into one in other places. It is unusual, because I think just the role of public health is so important for all sorts of reasons. And at the moment, we see the effect that the pandemic has had. It's not going to go away. I mean, if you listen to the science, then the second wave is around the corner. So there is that too. And it sounds to me like a huge load for one person. But it is that the role of public health should have its own standalone director, and that's my biggest concern. That I just think it doesn't give it the status it deserves. And is this the best way to save money?
It wasn't there as a saving. It was there as a risk-assessed route forward and a recommendation that our structure was a bit dysfunctional with the span of control that we had and the level of duplication. It does save a small amount of money.
It is highlighted in the report that there will be a saving.
Well, it's hard for me to present something that costs more in management costs, so we'd always cover it off. But it's factual rather than the driving factor.
And the conversation we've had actually is reinvesting that amount of money in the public health team.
Yeah.
The statutory requirement, whilst there is a statutory requirement in terms of what the Director of Adult Services delivers, there isn't a statutory requirement about them in terms of their qualifications, if that was the question, if I've understood Leslie correctly.
Whether or not the association did expect to see certain as a certain criteria that had to be met. That was my question. Okay.
No.
Would you see this carrying on in this way, or would you see possibly it sort of unravelling again and being two places? And with the deputies, particularly in adult services, would you be supporting them in development?
Shall I go?
Okay.
No, I don't think I would unravel it if because the senior structure, it's a sheer amount of duplication between those posts, which has been evident, from me just attending meetings occasionally, which they're both at. The conventional model would be the public health sitting under the adults role, which I think, I suspect you'd actually agree wouldn't be the right thing to do. So I'm not sure I would unpick it, but it is all about confidence in personalities as well as perfect models. So yeah, that's where I am on that. What's the second question was?
Well, just my general concern about public health in general, its importance in society, none more so than at the moment, and sort of really belittling it to some extent.
Well, we've taken it seriously by virtue of less than a year ago we made a decision to invest in a deputy director of public health because we wanted, so we basically upped the standing of one of the consultant roles, and I think we've been incredibly fortunate in the strength of the appointment we made in Siobhan Farmer, and I suppose that's given us further confidence that this could work well with her in the deputy DPH role. Dawn's role is as a full director because it's essentially taken on the role that Tina Reid had.
Tim?
More of a couple of comments than a question, thank you, Mark. First of all, obviously, from my point of view as account member of public health, I've been to this in some depth. And the experience I've had throughout my time in this job, and most particularly in the last few months, is that this makes common sense. I've been in so many meetings with both Margaret and Sarah, and quite clearly, as Pete Bungard said, there is an overlap. I think it does actually strengthen the function of public health, not weaken it. I know more about Siobhan Farmer than I do about Dawn Porter, but certainly Siobhan, I think, has been an outstanding addition to the team and has helped.
To interrupt him, but you're very hard to hear. So could you possibly speak up, please?
I will try, Leslie. In my experiences with Siobhan as the deputy director, I think that she's done a great job, and I would agree at this stage it probably is not the right time to move her up any further, but her contribution has been very strong. I did obviously help to cover Roger Wilson's role for a while before Carol was appointed, And at that stage, working again with Margaret and Sarah, it does seem to me that there was clear overlap. So I think this proposal makes eminent sense, and I'm very happy to support it.
Ian's indicating. Ian? Ian, you're on mute.
Sorry. Mandy, it says that the current Director of Public Health post will be deleted. Will all functions of both roles be combined in one post? Will some functions be devolved? Now, I share the confidence in the Deputy Director of Public Health. I think it was an excellent appointment. But what are the implications for the Deputy Directors, maybe on both sides? If they're taking on higher level responsibilities, will their roles be upgraded? And hence, will they be paid more? And Mandy, you did actually say that money saved would be quote reinvested in the public health teams. Does that mean that the money being paid to the excellent staff there, perhaps for doing more work, will actually go up as well? And the bottom line on this, surely, is this proposal is designed to retain our current Director of Public Health. So am I right in thinking that the money that will be paid to Sarah, who I have the utmost respect for, in fact, you'll recall I was involved in her selection, and both her and also our Director of Adult Social Services have been such fantastic servants. I don't want to knock either of them, but my bottom line question is, how much will the new combined post be paid? I mean, is it £190,000, or what's the figure for the new combined post? Thank you.
Where did you get £190,000 from?
Well, give me the true figure then.
The grade of the new post is an exec director, so it's the RB9 grade that the Director of Children's and the exec director of Economy Infrastructure. So it's a peer with the 4 other exec director posts, which are Children's, Economy, Resources, and the Chief Fire Officer will all be on the same money.
And the topper grade is 140.
Okay, thank you. And what about the point I made earlier? Will the other staff in public health actually be paid more because some of the responsibilities will be devolved, perhaps not just in public health, but also in adult social services? Or will all of the responsibilities, which are currently part of both those directors' posts, be retained in one post? In which case, I do have some worries about overload, frankly.
As Pete mentioned, the Director of Public Health was a new appointment.
The deputy.
The Deputy Director of Public Health was a new appointment in order to sort of free Sarah up to have more time to consider the future, and because it justified it anyway. So she is already paid as the deputy to act to cover Sarah when appropriate. And there's the 2 posts in adults. One is Tina's replacement, and then there's Mark Branton, who covers some of the change in programmes. So at the moment, when we talked about reinvesting in its capacity to deal with the pandemic and the future response, in terms of broadening and strengthening the public health team rather than revisiting a grading structure.
So Ian, my view on this is I wouldn't expect Sarah to do the day job she's doing today, even when she's appointed to the new role. But I think what Mandy's saying is that's already been foreseen by the appointment of a deputy to take up some of the additional day-to-day tasks that Sarah would currently being covered. And I think probably, to be fair, certainly from my reflections on what's happened in the pandemic, something that Siobhan has already done. Now, I guess your question is whether or not that fits in with the current grading that the role has, or whether that will need to be reflected at some point. I think that's a fair challenge, and one that I think Mandy and Pete will have to take away with Sarah if she is to be appointed to this role, reflecting at some point in the future. So I think it's a fair challenge that's worth noting at this stage. Does that answer your question? I can't quite see. I just see the top of your glasses. Yeah.
Sorry. Yeah, that does answer my question. So by implication, she might in the future be paid more than the other directors.
Well, that's a Mandy and Pete problem to sort out, I guess.
But I still do worry that this is going to be, there's a risk associated with this combination. It hasn't happened elsewhere in the country, with rare exceptions. And I think there's a reason for it, because these are two huge posts. The Director of Adult Social Services is, I think I'm right in saying, Mark, isn't that the biggest expenditure, the biggest budget that there is in the county council? And the Director of Public Health, particularly during this pandemic, which is continuing, it will continue into the new year, is my prediction. That's a huge job as well. And to combine the two of them is very risky. And to take that risk without even having tested the water as to whether it'd be possible to retain the current structure is, I think, a doubled risk. And I'm not happy with it. And as with Leslie, I'm not happy with that risk has been properly assessed, frankly.
I mean, I don't see it the way you and Leslie see it, if I'm being brutally honest, because I think Pete and Mandy have described a hierarchy structure in other local authorities where you have a strategic executive director at adult social care and then a more junior director sitting underneath that who's effectively leading on public health. What we're doing is taking the talent pool that we have and elevating the current director of public health to an strategic director covering public health and adult social care, with the additional capacity of a deputy director of public health sitting underneath. So I think we've actually got an enhanced model over what other people have got, because we've got someone who's sitting at the executive level who has a public health background to help drive that agenda, and someone who is already, through this organisation, shown themselves more than capable to sitting across that entire public health, adult social care agenda and its interaction with NHS. So I must admit, I can't see where either of you are coming from, because this is an enhancement to what you would normally see in other local authorities. But that's my view, and I appreciate that might not be shared. But that's certainly the way I see it. Leslie, were you indicating or waving at me?
I'm not waving, I am indicating, and I will go back to my, I excuse me, I understand the argument. It's just that my concern is about the status of how public health is actually seen, and it is such a vital part of society. I mean, it deals with inequality. Over the years, it's dealt with stuff to do with sanitation, reduction in child mortality. I mean, so many areas have in life for society have been improved because of there being a public health role and understanding the epidemiology of it all. And so that aspect does really worry me. Just is Sarah interested in taking on this role? Has she been being, I don't like to use the word groomed, but has she been being educated to be able to move into it?
I don't think we'd be going through this process if she hadn't.
We invited expressions of interest from any relevant directors prior to designing the restructure, and this came from both Sarah and, I think, to a significant degree, from Margaret.
Cool. Anyone else?
You're on mute, Leslie.
Leslie, you're on mute. Okay, thank you, Leslie. Anyone else got any questions or comments? Carol.
Thank you, Chairman. I just wanted to make the point that Sarah and Margaret have worked so closely together during this period of the COVID pandemic, and they hold some of the key principles in the same level of authority in terms of wellbeing principle, tackling health inequalities, integrated care systems across the patch. So I think there's a significant amount of common ground that they cover, and any gaps can be fulfilled. We've got very able deputies who can develop into their role even further. And my concern would be that if this post doesn't exist, then Sarah may in fact not stay with us, because she is ambitious. And I think given that the quality of the work that she's provided Gloucestershire with in a very public domain in the last 6 months, she may well be poached. And then we'd be potentially left without an executive director of adult social care and a gap in public health. So I fully support this joint post, and I think it can only grow in terms of expertise and perhaps be a vision for other county councils and other authorities to follow. So I'm fully supportive of it.
Or anyone else got any questions or comments? I'm not seeing any waving frantic hands, so I'm going to refer back to the document that's in front of us this morning. Give me a second. And if you turn to page 5 of your packs, there are 2 recommendations, and then the committee notes that clearly there is a appointment subcommittee which we held on the 29th of September to address the outcome of the decision that is about to go before us. So I'm just checking to make sure I can see everyone. I think the easiest way to do it is a show of hands. If you're in favour of the recommendations as outlined in bullets 1 and 2 on page 5, please show your hand. 1, 2, 3, 4. Leslie, I'm not entirely sure what you're doing. I can't hear you.
I was just thinking
You're on mute.
No, I shouldn't be now.
I've got 4 in favour, against 1, abstentions 1. That is the grand total of 6, which, if my maths is correct, Sophie, is everyone who's entitled to vote on the call. So the recommendations have been carried. Bear with me a second, though I do believe that is the last item on the agenda. So unless there is anything else that we need to urgently discuss, which I have not been notified as chair, that concludes the meeting. Thank you very much.